Welcome back to What's Tea Podcast. I'm your host, Morgan San Diego. I'm so excited because today we're going to be talking about the differences between nurse practitioners and physician assistants. This is an episode that y'all have been asking for, and I have my friend Brandon with me. He is a PA. He's been practicing for 12 years. We're going to get into so much tea. Make sure you're subscribed and let's get into it. So excited, y'all. I have my friend Brandon with me. Brandon and I have worked together for years, like since I was a nurse, like a baby nurse. So I'm so excited because people always ask about the differences between physician assistants and nurse practitioners. And we're just going to get into it because you have more experience than I actually do. So you're OG in the game.
God.
Oh my God. Okay. So I know you went to Howard to start off. So tell us about your whole career trajectory. Like, where did you start? And how did you know that you wanted to be a PA versus anything else?
So funny enough, I really did not start out to be a PA. I was going to Howard for medical school.
No, I didn't.
That's all honesty. I wanted to do medical school. I got to Howard and I liked Howard for all the wrong reasons, partying, having fun. And then I was like, I don't know if this medical school thing is actually for me.
Yeah.
So then I quickly switched. I said, man, should I go to nursing school? But then the unique thing about Howard when I went there is that PA was still a bachelor's degree. So when I thought about it and I did the math, I'm like, I could go and get a 4-year degree in nursing or just get this 4-year degree in PA. And I said, you know what? I want it to be a doc anyway, so I'll just do physician assistant. That's honestly how I became a PA.
Okay. So it was a lot of things that kind of went into your decision. What about the career trajectory? So when you compare psych and Ps and nurse practitioners in general to PAs, where do you feel like you had the most opportunities? Where do you feel like you can kind of thrive the most?
As a PA?
Mm-hmm.
So I think that, as a PA, we thrive really much on being able to care for the patient, right?
Mm-hmm.
Letting the patient know that it doesn't actually take an MD to do what we do, right? I think that sometimes we can spend a little bit more time with the patient. We hear them. We take care of the patient from head to toe. And there's a little more empathy that's given. So, I think that that's really where PAs can thrive. I often, in the world, we don't really talk about it. We talk about APP. We lump us all together now, So, at the end of the day, NPPA, we're all in this together, So, I think that's how really we can thrive is just caring for the whole patient.
Okay. So there's a lot of differences between nurse practitioners and PAs.
Yeah.
I think the biggest one, when you pointed out about the schooling, and it used to be a 4-year bachelor's degree. Of course, now it's not. So it seems like as far as career and education, there's a little bit of a difference. Now, how did you make the decision to only decide to do PA and not nursing? If you could go back, would you change?
If I could go back, believe it or not, I probably would. I love being a PA, but my favorite specialty is actually OBGYN. And they use wipes more. So I think if I had to do this all over again, I probably would have became a nurse and went to midwifery school.
Okay.
But I think that with the difference in schooling, for NP and PA is that nurse practitioners really focus in on a specialty, which the PAs don't. They're going to learn the entire program in the 2 years from psych. I can never be a psych PA.
You didn't like psych when you used to come to our unit. He did not like psych.
Sorry, nurses would tell me what to do, period. But I really do enjoy what we do as PAs. But nurse practitioners, they focus on family practice, acute care, adult gero. That's how the alphabet soup comes along. I laugh about that alphabet soup that y'all have behind the name. It's cool. But I really do think that we don't specialize. So if I wanted to become in psych tomorrow, I don't have to go back to school to do that.
Right.
Or if I want to do family practice, I don't have to go back to school to do that. Where if you said, you know what, I want to do family.
I got to go back to school.
Got to go back to school. I think that that's really the difference between PA and NP is just the education and the test that we take. Also,
right,
we have to take that board every 10 years. So don't think you're going to forget what you learned in school back in 2012 because you got to take that board again. Right? Don't think
Wait,
you have to do that.
I didn't know that. So as far as like career and I'm sorry, and as far as education. So our education, we're both master's degree programs now. So that's not different. But of course for PAs, you require like clinical hours before you can actually like get into a program. So that's a big difference from nurses because I mean technically now I don't recommend it, but nurse practitioners can literally go to nurse practitioner school right out of nursing school. I hate it actually.
I used to feel that way, but you know what? I look at it as a different side. I think that the nurses that I've worked with that went to nursing school and then became an NP after, I
Yeah.
think they make really good NPs. I think that when you're at the bedside too long, it's hard to change that mindset of thinking like a nurse. So I think that the longer you're at the bedside, it's really bad for your provider career that you're going to go on because you're stuck at always being told what to do and not actually thinking like a provider. So I used to think
I never thought
that. I used to think that way, but I think that actually less time at the bedside is better.
Okay, let's get back to that having to take a test every 10 years because so for our certification and to keep our certification, because I just renewed my expensive, very expensive license. I think it was $200. Um, but just renewed my license, and I just had to, put in my CEU. So basically, just saying, okay, I went to these classes and did this coursework, so I don't have to ever retake my APRN psych exam again. I was having panic attacks during the exam. It was bad. It was harder than the NCLEX. And some people say that, oh, it's not. It was definitely harder than the NCLEX. So you're saying you had to sit and take an exam every 10
Every
years?
10 years. And, I think that that's what allows us, though, to be able to switch our specialties so
Yeah.
as to not have to go back to school. Now, of course, like the exam is really basic knowledge. I don't care if you're a derm PA or a hospitalist PA or working in the ICU. The basic principles you should be able to pass on that test
Yeah.
because our test is really geared towards a family practice PA.
Yeah.
And it will have some subspecialty questions on there, but they're very basic that, I mean,
You should know.
we should know.
Mm.
And I think that that's the beauty of it, though, is that we are able to switch in and out.
Okay, so let's talk about the pay. Now, as far as pay wise and pay trajectory, who do you feel like makes more?
So in the hospital, I've only done hospital medicine. I've only done hospital medicine. They group us together.
Okay.
So, I think our pay is the same. I don't think there's any difference. I always tell the nurses who say they're going to become a PA or a nurse practitioner for the money, I'm like, well, you might make more as a bedside nurse with your 3 shifts and an extra. I don't know. So if you come, I tell the nurses all the time, if you're going into this because you want to become rich,
Don't do it.
do something else because
Yes.
it's not it. It's definitely not it. You got to have a passion to want to do it. So I mean, I've been doing well ever since I graduated from PA school.
Yes, you have, and I love that for you. Now, what about autonomy? So that's the one downside I think that doesn't really make sense to me that PAs don't have autonomy. Well, you're said to us.
Have a great lobby, right? And I think that you guys fight a lot harder than we do as PAs to get that autonomy,
Yeah.
and that independent practice.
Yeah.
Because there's really no reason why I, as a PA, should not be able to practice medicine independently. What does that really mean, right? Like what? Because I guess legally on paper, right? I always have to have a supervising physician, but 12 years being a PA and my attending is not really coming every day, checking every little thing that I'm doing. Well, yes, he or she is there to help me and to navigate the patient. And honestly, sometimes my attendings who are new grads from residency will be coming and asking me questions, So I feel like to answer your question about autonomy, I think that's the biggest thing that is the difference between us is that,
Right.
nurse practitioners can practice independent. And I always say, if you're a new grad NP, just because you can doesn't mean you should.
Yes.
Just because you can does not mean you should. There's a lot of liability with practicing independent. And as a new grad, whether you're a PA or a nurse practitioner, you need that person to be watching what you're doing. They can teach us what they teach us in school, but that's school. That's not clinical practice. And these are people's lives that we're dealing with, you know? So I do think having some type of supervision in that first look at you is definitely helpful.
Yeah.
Because, you know, we as APPs, we don't get the grace that physicians get. Okay. Dr. So and so can be a bad doctor. He can mess up, and everybody's just going to say he's a bad doctor. They're not going to talk bad about the
profession as a whole. Right.
let you, Morgan, go and mess up on a patient. Let me go and do something crazy. They're going to say, see, that's why MPs, that's why PAs shouldn't be doing X, Y, and Z.
Exactly.
So that's why I think, you know, definitely having supervision in the beginning before you go out and do that autonomy by yourself is definitely important.
Yeah. So also for people who are kind of confused about what we're saying as far as the autonomy, so in the state of Georgia, where we are, our lovely state of Georgia, nurse practitioners and PAs, neither one of us can be autonomous. So that means you can practice without, a physician, a MD or DO supervising you. So certain states allow nurse practitioners to be able to practice by themselves without physician oversight. Georgia is not one of those states.
Georgia is different in many ways.
When I came here and found out you couldn't get liquor until, 12 p.m. on a Sunday, I said, I don't even know if I want to be here.
I think that that's the way that the physicians, they're threatened. They are threatened, and I don't know why. I'm not here to cut over your
Rachel's, yeah.
I wanted to be a physician. I could. I'm not here to take your job or to make you go away. I'm here to help you. And you at all are not a threat to me. You get your bag like I'm going to get mine. Just respect what I do. And I think that they do that so that they can keep us over here. You know what? Let's tell these MPs and PAs they can't prescribe narcotics. Let's tell them that they can't order imaging studies. Let's do all these things that really don't make sense. You know, like I can't in the state of Georgia order restraints for a patient, but I can give him all the Zyprexa, all the Ativan, all the chemical restraints I want, but I can't physically give him like mittens, or it just doesn't make sense. And I think that that's the way that the physicians lock us in.
Mm. That's kind of crazy. So do you feel like the idea of the physician oversight makes you ever want to like become a nurse practitioner? Or just think about it, because let's say in Georgia, because we lobby for that all the time, what if Georgia decides, hey, nurse practitioners after they have 5,000 hours can be independent? Like, does that ever make you want to be like, maybe I should?
True and true. I'm a PA to the bone. Now, I don't think I have the nurse. I'm not a nurse. Like, I know through and through that I do not have that little within me that nurses have. I've never considered it, honestly. Going back to be an NP other than the midwifery.
And so how important do you think mentorship is? Like when you were going to PA school and when people, now are going through PA school, do you feel like having a mentor is really important? And how do you foster those relationships? Like how do you even find a mentor?
Yeah, I think that having a mentor, no matter what you're doing, whether it's becoming a nurse practitioner, a PA, MD, whatever, having a mentor is great, right? Because they're going to be able to help foster you. They're going to be able to help guide you and lead you on the path to where you want to go. They help you to basically, like show you the way, what you're doing wrong, what you don't need to do, what you should be doing. And with that, with a mentor also comes a network. So they can be like, hey, I'm really interested in ortho. Oh, I have a friend who does ortho. Let me hook you up with them. Or, they're interested in psych. I'm like, well, I have my friend, we're psych MP. Let me put you in contact with her, So I think that having a mentor is definitely a good thing, especially in this world where, let's be honest, like it's becoming oversaturated. It really is, right? So having that plug to be able to help navigate you through, I think is very helpful.
Yeah, I agree. And when you did PA, what did you do as far as your hours? Like, how did you get your hours that you had to?
I am old school PA. I had bachelor's degree in PA. And then I went back and got my master's. So it wasn't as hard for those hours. So I just shadowed. My godmom's a nurse. I went to the cardiac cath lab. I scrubbed in on cases with her.
Oh, the soft nursing. Well, that's what the girls say are soft. Oh.
I scrubbed in with her, but now I understand to be a PA, you have to like really do like patient care hours, whether it's a
Yeah.
T or spec, scribe. So uh, I just shadowed, I just shadowed.
So you got your hours a little old
A little
school.
old school.
So do you feel like that that strategy is still good today, or do you feel like people should do something
You
different?
got to do more now. I mean,
Okay.
it's very hard to get into PA school. I think I was reading on Instagram and TikTok that actually it's easier to get into medical school than it is PA school, and that's just because the classes aren't that big. So you've really got to do something that's going to be shocking to the people for you to get into PA school, because everyone that applies to PA school is smart. Everyone's a straight A student, has a 3.8, 3.7 GPA, top of their class. Uh, so you got to be different. So I always tell people that it's the grades that get you into PA school for the interview, but the interview is actually what gets you into PA school. So definitely, yeah, no, not shadowing, not today.
So wait, it sounds like it's harder to get into PA school than it is to get into NP school. Because like that's my running joke with people is that nurse practitioner school, especially like now, there's so many schools that are just focused on being diploma mills that it has kind of dampened the profession.
It has, and I get very annoyed with that.
Oh, I do too.
Because again, I've heard from my physician friends, they do not distinguish the difference between us. They call us APPs. She's like,
All mid-level.
are mid-levels, which is totally incorrect. I don't provide mid-level care. I actually provide,
It's very rude.
it's very. So I hate these diploma mill schools. And I say I hate that because how are you getting it all straight A's in MP school? How? I don't get it. And then you come to work and you know nothing. And it's just like, I feel like when you go to those schools, they're just really taking your money and not giving you a valued education. So I'll be honest, back in the day, I didn't feel as though that when I had my friends who would go to these MP schools online, that they were qualified to do the job because they didn't understand the pathophysiology. They didn't understand how to make a diagnosis, how to come up with differential. I cried many days in pharmacology,
Yeah.
how to actually practice medicine. And you are going and working your 312s while you're online doing this MP school, and then you're graduating, and now you can go practice medicine independently. It baffled me. It baffled me. But I do think so, that they should, or I don't know, are they still doing these online schools where
It's they're still doing the online schools. And I don't know what politicians they got in their pocket, but to me, it's just crazy that you can have a school with 100% acceptance rate.
right? And another thing is, I don't understand either, is like, so to be a CRNA, you cannot go to CRNA school just from being a fresh nurse. Now, earlier I said that I think that it's okay if a nurse just goes straight to MP school, and I still believe that. Maybe spend 1 or 2 years at the bedside max,
Yeah.
right? So that they don't get stuck in that nursing brain. But I don't understand why, for any other type of NP, you can graduate nursing school yesterday and be in
Have no
school
experience.
tomorrow.
Yeah.
It's CRNAs do a great job, and the work that they do is very hard, but it doesn't go to say that what we do as psych NP or as a family practitioner, nurse practitioner, doesn't require just a little bit more to get into the program.
Yeah.
You know what I mean?
I agree. I agree. The diploma mills, I feel like are very problematic because the schools have these people getting in, and then the problem is that when they graduate, especially now, you go to Indeed, you don't have to even believe me. They're saying they're not taking students from this school. There are certain clinical sites that won't take you from certain schools. And, then they get mad at me. And I say, look, I talked about it. I tried to warn y'all, but some of y'all, like my mama said, a hard head makes a soft behind. So some people just gotta F around and find out.
Period. And I see that as well a lot at my job. Like, if you go to X school, they're not taking you, even for rotation. So I do think that if you are going to, because nurse, from what I understand, remember I'm a PA, but from what I understand from my nursing friends is that NP school focuses heavily on your nursing background.
Yes.
And if you don't have that nursing background at the bedside, then I do believe that the schooling needs to be a little bit more in depth to be able to practice, right? Because that background, that nursing background is gone. You don't have it. We just graduated nursing school yesterday.
Exactly.
You barely know the difference between core egg and metoprolol.
So, okay. So my question is, so after you have all this experience now, you said that it's very clear that you would still choose PA,
I
right?
lived through.
What about now? For people who are coming in now, what would you recommend that they do, and why?
So if you're already a nurse, I believe that you should probably go to MP school because you can still work.
Yeah.
It's going to be easier for you. But if you are knowing that at the end of the day, you want to practice medicine, you should just probably go to PA school and just skip out that whole nursing degree, in my opinion, right? In my opinion, of course, I'm biased. I'm a PA. I'm going to don't say that I'm biased. But I do believe that if that's your goal, just go to PA school, you know? There are programs out there that are 5.5 year programs. You get your bachelor's and your master's in that whole program. So there are ways to shorten down the time. So yeah, I would. So to answer that question depends on what your background is. If you're a nurse, NP school. If you're just starting out, heavily consider becoming a PA.
And then also too with the clinical aspect, I like that because right now the whole concern is that a lot of people are struggling with trying to find clinical instructors and find preceptors. And with PAs, physician assistants, you already get your preceptors through the program.
Yes.
You don't have to go search.
No, that's crazy. So I have some friends, that I work with now who are like, Brandon, I can't find the ER rotation. I can't do this, can't do that. That's crazy to me. You're paying the school, so they should be finding you a rotation for you. So I do think that's the beauty of PA school is that all of your rotations are covered through the PA program. These PA programs establish relationships with the different clinics and hospitals out there so that they have you
Yeah.
and they take you. So I didn't have to fight to figure out which rotation I was going to go to. It was already preset. They actually hire somebody to be the clinical educator in the program. So that's a person that's all she does or he does is find these rotations.
Hmm. Okay. And closing out, do you have any advice for anyone who's interested in being a physician assistant, or I'm sorry, physician associate? Because I'll change our name.
Change that. That's a very important because everyone thinks that I assist the doctor, but I don't. I don't assist the doctor. So I still call myself a physician assistant. But I guess the technical name, the correct name is physician associate or just PA.
Yeah.
But anyone that wants to be a PA, I would just say, like figure out like why you truly want to do it. Get a mentor, actually see what it is that we do. And just go for it. Like, right. Like, and if you apply to PA school the first time, because we have to apply through CASPA, if you apply for PA school the first time you don't get in, apply again the next year.
Don't get discouraged.
Yeah, and you know what? We like labels, but you don't need to go to those labeled schools, those high-end schools that are charging you a lot of money. Just don't go to school just because of the name. Just go to the school that's going to make sense for your budget. It doesn't make sense to be paying all of this money for these high-end schools. Just go to where it makes sense for you and your budget is what I would say.
Oh, that's right. Okay. Well, thank you again, Brandon, for coming on the podcast, and then let people know where they can follow you and find you if you want to be found.
All right. So on Instagram, I am B_the Virgo. That's where you can find me. If you have any questions about becoming a PA or interested in the profession, just reach out to me and I'll be happy to help you. Morgan, I'm so proud of you. Oh my God. It's been a time, baby nurse. I know. It's been a time. We were keeping.
Oh my gosh. All right.